Hi, my name is Carmen. I'm an FNP student. I'll be here to do your head-to-toe examination. Can you please tell me your name and date of birth?
My name is Shirley. My date of birth is August 12, 1994.
Perfect. And what's today's date, and do you know where you are?
Today's date is August 3rd, 2021, and I am in LIU campus, Brooklyn.
Perfect. So I'm going to do a quick mental status exam on you. I just want you to remember 3 words: fun, bear, and flower. And then I'm going to actually repeat those later. Can you just count back from 100 in intervals of 10?
Sure, so 100, 90, 80, 70, 60, 50, 40, 30, 20, 10, 0.
Perfect. And what were the 3 words I told you?
Bear, fun, and flower.
Okay, perfect. Okay, so your alert and oriented times 3. Your clear speech adjusts appropriately. There's no impairment to memory or cognition. Okay, so next I'm just going to take a quick blood pressure on you.
Okay.
Have your blood.
Okay.
Okay, so blood pressure was 112/79. That's actually pretty good. I'm also going to test your pulse here as well. Okay, so pulse is 75. So that is good. It's within normal range. So first, I'm just going to take a quick look at your skin. Okay, so if you could just lift your arms up and down. Very good. Okay, just have to take off your socks. Sorry. Okay, so toes are okay. Just going to take a quick look at your back. Okay, so skin is pink with no visible masses or lesions noted on either of your arms or legs. Okay, I'm just going to quickly feel for your arms as well. So your skin is warm to touch as well as your legs. Okay, there is good skin turgor, and there's no induration and tenderness to palpation. Perfect. Okay, so I want to take a quick look at your head. So head is round, normal cephalic, proportional to the body. Just going to have you bend your head slightly so I can take a quick look at your scalp. So there's no visible infestations, masses, lesions. Quickly palpate. I do see your hair as well. It is evenly distributed and it's fine, and there's no palpable masses or tenderness to the palpation. Okay, so next I'm looking at your face. Face is symmetrical. Okay, there is no edema and there's no visible masses or lesions on the face as well. So I'm going to do a quick cranial nerve test. Testing your facial muscle will be cranial nerve number 7. Just puff out your cheeks for me. Make a big smile, frown, and then raise your eyebrows. Very good. So cranial nerve number 7 is intact. So next I'm going to test for sensation in your face, which is cranial nerve number 5. Please close your eyes. Okay, and then just point to where you feel a touch. Very good. Okay, so cranial nerve number 5 is intact. So you can open your eyes. Next I'm going to just take a quick look at your eyes, checking your eyebrows first. Okay, so hair is evenly distributed and symmetrical on both sides of your face. Then your eyelashes are also the hair is also evenly distributed and symmetrical on both faces. Could pull down your bottom lids for me and your top lids for me as well. Very good. So your conjunctiva is pink and moist with no visible abrasions or lesions. Okay, so looking straight ahead, just to look at your corneas and your irises. They're both clearly defined with pupils measured at 3 mm and centered. And sclera is white on both eyes as well with no visible abrasions on the eyes. Okay, so I didn't get to check your temporal artery, so let me just do that really quick and palpate it. Okay, so it's 2+ with no tenderness to palpation. All right, so going back towards the eyes, next I'm going to just check your visual acuity. That also tests your cranial nerve number 2. Do you wear any corrective lenses? Perfect, so I'm going to have you cover your right eye first. Just read line number 8 for me, please.
DEFPOTEC.
Perfect, so left eye is 20/20. Now cover your left eye, read with your right line 8.
DEFPOTEC.
Perfect, so your right eye is also measured at 20/20, so that it also proves that your cranial nerve number 2 is intact. Okay, so next I'm going to just check your accommodation to light. Okay, just look straight ahead while I shine a light in your eye. Okay, so right eye is round and reactive to light. And then left eye is also round and reactive to light. Perfect. So next, I'm going to test for cranial nerve 3, which is the convergence. If you could just look at my finger and just follow it. Very good. So convergence is noted. There's no nystagmus. Cranial nerve number 3 is intact. Next, I'm going to be testing for cranial nerves 4 and 6, which is going to be testing your visual fields as well as the oculomotor nerves. Okay, so just first I'm going to do the oculomotor. Just follow my finger. Their eyes, perfect. Okay, so that is intact. There is no nystagmus with that as well. Next, I'm going to test your visual fields, covering your left eye. I'll close my right. Tell me when you see my hand.
I see it. I see it. I see it. I see it.
Very good. So we're going to do the opposite side as well.
I see it. I see it. I see it. I see it.
Very good. So there is no visual field deficit, and cranial nerve number 4 and 6 are both intact. Okay, so next I'm going to take a look at your ears. Just going to have you turn your head side to side for me real quick. Very good. So there's no visible lesions on both ears. Sorry for the cold hands. Okay, so the mastoid process and the tragus is intact, and there's no tenderness to palpation. Right, so I'm going to take a quick look at the, sorry, actually I meant to take, check your eyes with the endoscopic exam. So let's just go look straight ahead. Shine the light on your eyes. See the red light reflex? I'm just gonna go in. Okay, so there's no opacities. Cup to disc ratio is normal, and the optic disc is visible. Okay, so the same thing, look straight ahead. I'm gonna look at your left. Okay, so there's no opacities also on the left side. Cup to disc ratio is normal. Optic disc is also clearly visible. Okay, very good. Sorry, so going back to the ears, I'm just gonna take a quick look at your ear canals since I already palpated and inspected it. Okay, just gonna pull this ear slightly. Okay, so I do see your canal, it's pink. Tympanic membrane is visible, pearly gray with no perforation, and little to no cerumen, and cone of light is at 5 o'clock. Perfect, okay. I'm gonna go on your left side now. Okay. Okay, so I'm gonna have you tilt your head down a little bit towards me. Okay, so I'm just gonna. Okay, very good. Okay, so the canal is pink with little to no cerumen. Tympanic membrane is pearly gray and it's intact with no discharge. And the cone of light is at 7 o'clock. Perfect. So next I'm gonna test for your hearing. Okay, so first test is going to be the Weber test. This is going to test for the conductive and sensorineural hearing. So please tell me if you can hear in both ears.
I hear it on both ears.
Perfect, so that's good lateralization in both ears, so that's no sensorineural or conductive hearing loss. Okay, so next is going to be the RIN test, which is going to test for air conduction over bone conduction. Please tell me when you stop hearing it.
I stop hearing it.
Okay, what about now?
I stop hearing it.
Perfect. Okay, so on the right ear, air conduction is greater than bone conduction, which is completely normal. And do it on the left side.
Okay, I stop hearing it.
What about now?
I stop hearing it.
Good. So air conduction is greater than bone conduction on the left side, which is also normal. Okay, so next I'm going to do the whisper test. I'm going to start with your left ear, and just when I whisper the word, please just say it out loud.
1, 2, B.
Very good. Okay, on the right side.
1, 4, T.
Okay, very good. So all this test actually also tested your cranial nerve number 8, which is the acoustic nerve, and that is intact. Okay. So next I'm going to take a quick look at your nose. All right. So nose is midline intact. Okay. And then I'm just also going to quickly palpate for your frontal sinuses for any swelling. So there is no swelling. Maxillary sinus is also no swelling as well. So before I actually take a look at the inside of your nose, I'm going to test for your sense of smell. So please close your eyes, and I'm going to occlude one nostril, and you're going to tell me what you smell.
Alcohol pad.
Okay. And this.
Alcohol pad.
Very good. Okay, so your cranial nerve number 1, which is the olfactory nerve, is intact, okay? So next I'm just gonna take a quick peek inside of your nose to see how it is. Okay, just tilt your head up for me. Okay, so the right nasal canal is pink with no discharge, and nasal septum is intact and not deviated. Okay, going on the left side. Okay, so same thing here, pink, no discharge, nasal septum is intact and there's no deviation. Okay, there's also no swelling noted to bilateral nares as well. So next I'm gonna take a quick look at your mouth. Okay, so skin is smooth. Okay, and it's pink, there's no visible lesions. Just pull down your gums for me and see. Very good, and then your top. So very good. So gums are pink and moist and there's no sores and there's no ulcers noted. So I'm also gonna really check your TMJ here. Okay, so just gonna feel for it here. Okay, just open your bottom jaw, move it side to side. Very good. Clench your teeth. Very good. So there's no tenderness to palpation to the TMJ and it's actually intact. Okay, so next I'm just gonna have you open your mouth. I'm gonna take a quick look at your mouth. Okay, so there is good dentition. Oral mucosa, buccal mucosas on both sides are pink and moist with no sores underneath. Okay, so next I'm just gonna have you say ah. That's gonna test for cranial nerves number 9 and 10. Okay, say ah. Very good. So the palate rises and falls nicely. Uvula is midline. I do also see your tonsils, which is +1 bilaterally with no exudate. There was no cobblestoning noted as well, and that also indicates that your cranial nerves number 9 and 10 is intact. Next, I'm just gonna have you stick out your tongue, which is gonna test the movement of your tongue. That is to make sure that your cranial nerve number 12 is intact. So please stick your tongue, move side to side, up and down. Very good. So cranial nerve number 12 is intact. So next I'm gonna take a look at your neck. Just raise your head slightly. Very good. So there's no swelling and there's no visible masses or lesions on the neck. I'm just gonna feel for your trachea, which I do feel it here, and it is midline. Okay, there's no deviation. I'm gonna come to the back. I'm gonna have you swallow. Very good. So I do feel your thyroid, which rises and falls nicely, and it's non-swelling and non-tender to palpation. At the same time here, I'm just gonna take a quick look at your cervical spine. Okay, just bend your head forward a little bit. Okay, so your cervical spine, there's no misalignments to your spine, and there's no crepitus to the cervical spine as well. Okay, so next I'm gonna take a quick look at your chest. All right, just move your hair a bit here. Okay, so there's no use of accessory muscles during breathing. It's unlabored. There's no visible masses or lesions on the chest. Okay, just gonna quickly palpate. Okay, so there's no palpable masses or tenderness to the chest as well. So while in this position, I'm also gonna just check your breathing. Okay, so respiratory rate is 16, okay? So next I'm just gonna have you turn your back to the camera. Just gonna check your back right here. Turn it a little bit more actually. Okay, very good. So in the camera, okay, so there's no visible masses or lesions on the back. I'm just gonna quickly palpate. Okay, so there's also no palpable masses on the back as well. So next I'm gonna check for firmitis. So please say the number 99.
99,
Okay.
99, 99, 99, 99.
Very good. So next I'm gonna percuss your back for any resonance. Okay. Okay, so there's resonance throughout all fields of your lungs and it's bilateral. Okay, so next I'm just gonna take a quick listen to the back of your lungs. Okay, so just breathe like you normally do. Very good. It's good lung sounds there. Good lung sounds there. Good here. Good here. Okay, take a deep breath here. Take a deep breath. Very good. Take a deep breath. Okay. Take a deep breath. Take a deep breath. Good. Take a deep breath here. And then take a deep breath here. Very good. So normal lung sounds, there's no wheezing, crackles, or rails heard on any of the fields of the lungs bilaterally. So next I'm just gonna test for egophony. I'm gonna have you say the letter E while I listen to your lungs again. Okay, so, okay, go ahead.
E.
Okay.
E. 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 E.
Very good. So this negative for egophony, I heard the E perfectly clear. Okay, so next I'm just gonna do another test. I'm gonna have you whisper the number 99. That's just to see whether I can hear that whisper clearly or not. Go ahead. Okay, perfect. So I was not able to hear the 99, which is completely normal in all fields of your lungs. So I'm gonna have you just turn back towards the front. Okay, doing the same thing as I did before earlier. I'm gonna have you say the number 99 when I ask you for tactile firmitis. Okay.
99, 99, 99, 99, 99.
Okay, very good. So next I'm also gonna percuss the front for your resonance. Okay. Okay, so there is resonance on all fields of your lungs bilaterally, so that's good. Next, I'm just gonna listen to the front as well. Okay, just breathe in deeply. Very good. Very clear. Very clear. Very clear. Okay, it's very clear. So there is there is normal lung sounds in all fields of your lungs with no wheezes or crackles or rails heard. Okay, so next I'm gonna listen to your heart. So before I do that, I'm just gonna take a quick look at your hands. Okay, we're gonna test for capillary refill. Okay, so there's capillary refills is less than 3 seconds. Now I'm gonna check the refills on the foot. Okay, so capillary refills are also less than 3 on both feet. Okay, perfect. I'm gonna have you just do this. This is gonna check for clubbing. So I'm gonna have you just all the way like that with fingers touching. So I do see the diamond shape that indicates no clubbing, and there's no cyanosis noted to either of your extremities. Okay, so next I'm gonna just listen to your heart sound. So before I do that, I'm gonna quickly palpate for your valves. Okay, so in the second intercostal space, this is the aortic valve, which I do feel here. Then it's the pulmonic. Okay, then on the left sternal border is your tricuspid. Then it's your mitral valve on the left fifth intercostal space in the midclavicular line. Okay, so next I'm just gonna take a quick listen to it. Okay, starting with the aortic. Okay, so there's no murmurs here. Okay, sounds great here. Then I have the tricuspid here. I hear the tricuspid perfectly. And then it's the mitral valve, which sounds great here. So normal S1, S2 sounds. I have not heard any murmurs or gallops. Okay, using the bell, I'm gonna try to listen to it again. Aortic, your pulmonic, very good. Then it's your tricuspid. And then your mitral, which is great. Okay, so next, I'm gonna just have you lay back on 30 degrees. Let me just raise the head of the bed a little bit. Okay. On this part, shutting down. Okay, very good. So in this position, I'm gonna check for your carotid. I'm gonna have you turn your head towards the wall. Okay, so I do see a visible carotid there, no visible JVD. Okay, on this side as well, I do see a visible carotid and no visible JVD. In this position, stay this way. I'm just gonna quickly listen to the bruise there to see if there's any. Okay, so there's actually no bruise, and I'm gonna quickly just palpate it right here. Okay, so it's at 2+, okay? So we're gonna turn back. I'm gonna just listen to whether there's any bruise at the carotid here. And there's actually none. I'm just gonna quickly palpate it here as well. Perfect, and it's also measured at 2+. Okay, so staying in this position, I'm just gonna quickly listen to your heart as well, one more time. Okay, starting from the aortic again. Then it's your pulmonic. Then it's your tricuspid valve. Very good. Your mitral valve. Okay, and I'm going to listen to using the bell of my stethoscope again. Aortic valve. Your pulmonic valve. Your tricuspid valve. And your mitral valve. Very good. So in this position, I am also going to be feeling for heaves and thrills. Okay, so there is no heaves there. Very good. So starting with the aortic, there is no thrill. The pulmonic, there is also no thrill here. Tricuspid, there is also no thrill here. And then last but not least, your mitral valve, there is also no thrill. So there's also normal S1, S2 sounds that I heard earlier with no murmurs or gallops. So next, I'm gonna have you turn to your side and I'm gonna measure for pulse deficit, okay? So while staying like this, I'm just gonna quickly feel for your pulse maximum right here, okay, which I do feel it. Okay, very good. So I don't feel a pulse deficit. Okay, perfect. So I'm gonna have you just turn back really quickly onto your back one more time. So since I have you flat on your back, I'm just gonna also listen to all the bruise at the same time. Okay, starting with your abdominal aorta. Okay, so there's no bruise there. Then it's your renal. There's no renal bruise there. Then it's your iliac. There's no bruise there. And then your femoral. And there's no femoral bruise there. Okay, so also in this position, I am also going to measure and palpate for your pulses, starting with the brachial. Okay, so I do feel it here, 2+, bilateral arms. Then it's your radial. I do feel it here as well. It's also bilateral, 2+. Okay, then it's your femoral. Okay, so I do feel it here as well, and that's also 2+ as well. Okay, then it's your dorsal pedal pulses. Okay, so I do feel it here as well. It's 2+ here. Then your posterior tibial. And I also feel the pulses here in the back and the posterior tibial bilaterally, 2+. Okay, so next, while in this position, I'm just gonna lower the head a little bit more. And I'm just gonna really start looking at your abdomen. Okay, so your abdomen is round and symmetrical with no visible aortic pulsations and no visible masses. I don't see any. Okay, so next, I am just gonna listen to your abdomen, okay? For some bowel sounds. Okay, starting from the bottom. Okay, so I do hear some kinks and gurgles in the right lower, kinks and gurgles in the right upper, kinks and gurgles in the left upper, and kinks and gurgles in the left lower. So just gonna quickly listen to this area here, as well as the left upper here. So I don't So it's normal active bowel sounds in all 4 quadrants, and I also don't hear any liver or splenic friction rub as well. Okay, so next I'm gonna percuss your abdomen. Okay, I'm just gonna kind of flip this down a little bit. Okay, starting from the left quadrant, I'm sorry, the right lower quadrant. Okay, so I do hear the abdomen is tympanic with scattered dullness throughout. So next I'm going to use percussion to measure your liver. Okay, I think I heard something. Let me just check again. Okay, so I do hear that. I'm going to make a quick mark. Okay, very good. Starting from the top again. Okay, I heard something there. Let me just double check. Okay, so I do hear, so I'm going to make a quick mark here. Very good, and I'm just going to quickly measure it to see your liver size. Okay, so liver is measured at 8.5 centimeters, which is actually within normal range. So now I'm going to also percuss for your spleen. Please take a deep breath. Okay, one more time. Okay, one last time. Okay, so all I heard was tympani, and it's negative percussion sign. Okay, so next I'm going to do some light palpations. Okay. Okay, so there's no rigidity or guarding to light palpations, and there's no tenderness to palpation as well. So now I'm gonna press a little bit deeper for deep palpation. Okay, so there's also no abdominal rigidity or guarding noted to deeper palpations. Okay, very good. So next I'm gonna palpate for your liver. I'm gonna put this hand underneath here. Okay, just relax this arm right here, yep. You could just relax here, yep. And then take a deep breath while I press into your abdomen. Okay, so I do feel your liver here. All right, edges are sharpened and it's smooth and it's non-tender and there's no palpable irregularities. Okay, perfect. So I'm gonna also do that for your spleen. I'm putting one arm here. Take a deep breath. Okay, so your spleen is actually non-palpable, which is completely normal. Okay, perfect. So next, I will be testing your muscle strength and your neuro. Okay, so if you could just sit back up for me really quick. Perfect. Okay, good. Okay, so first I'm gonna just have you bend your neck down, go up, move it side to side. Perfect, so there's good range of motion for your neck. Okay, so I'm gonna put my hand here, don't let me push your face. Okay, do the same on the opposite, don't let me push it, very good. So there's actually good muscle tone for your neck. It's measured 5 out of 5. Next, I'm gonna just check your cranial nerve number 11, which is really just shrugging your shoulders. I'm gonna put my hand and just shrug it. Very good, so that's cranial nerve number 11, and that is intact. I'm also gonna check your shoulders right now. So I'm just gonna first feel for it. So I do feel the clavicular here, and then there's also the acromion here. There's no crepitus on the right side, no bursitis or swelling also, and there's no on the left, the left side, and there's none on the right side as well. Okay, checking your range of motion. Very good. So there's good passive range of motion. It's also good passive range of motion on the left. Okay, so next I'm gonna have you just raise your arms up, both of them. Okay, extend it all the way in the back. Very good. Now just follow me like this. Very good, and do it on the opposite side. Very good, so the fingers are touching, so that's good active range of motion. Next, I'm gonna take a quick look at your elbows. Okay, just gonna palpate it, so there's no bursitis, no swelling noted to the right side. There's also no crepitus, swelling, or bursitis noted to the left side as well. I'm gonna just quickly check your range of motion here. Very good passive range, and also very good passive range of motion on the left. Okay, so then afterwards, I'm gonna just have you extend both arms, flex them, turn them inwards, and turn them outwards. Very good, so that's good active range of motion. Now keeping your arms flexed, I'm gonna try to pull, please don't let me pull. Okay, and I'm gonna try to push, please don't let me push. Okay, very good. So there's good muscle tone, and the strength is measured 5 out of 5 for both arms, okay? I'm sorry, for both elbows. Next, I'm gonna just take a quick look at your wrist here. So the joint is there is no bursitis, no swelling. Same thing here, there's no swelling or bursitis noticed to the joint. Okay, I'm gonna quickly just feel for range of motion, which is actually very good. Next, I'm gonna have you test your wrist range of motion by pressing up, face it down, inwards, inside. Very good, so there's good active range of motion. Now keeping both fists, I'm gonna try to push your wrist down, try to fight against it. Very good, I'm gonna try to bend your wrist up, keeping your fist closed. Don't let me do it, very good. So there's good muscle tone, and it's measured 5 out of 5 for both wrists. Next is your fingers. There's also no deformities noted to any of your fingers, no swelling, no joint dislocation, good range of passive range of motions on the left hand, and good passive range of motions on the right hand. So I'm just gonna have you spread your fingers, okay, keep them closed, okay, and then I'm gonna have you make a fist, extend, very good. So I'm gonna test your muscle strength, okay, so put in my fingers, don't let me pull out. Very good. Okay, so there's good active range of motion, and the strength is actually 5 out of 5 with good muscle tone on both hands. Next, I will be checking your hips. So please lay back down. Okay, very good. So first I'm gonna feel for your right. Okay, so there's no pain on the right side. There's also no pain on the left with no crepitus or tenderness to both hips. So I'm gonna just check your range of motion here. Very good range of motion. Passive range of motion, and there's also good passive range of motion on your left side as well. Okay, so what I'm gonna have you do, starting with your left side, please lift up your leg, move it to the left, move it to the right, bring your knees to the chest. Very good. Do the same for your right, left first, right, and then bring your knees to the chest. So that's good active range of motion. Now with my hands on this here, try to push against my hand, up, push up, lift up, very good. Okay, now don't let me pull you up, try to push down. Good, so there's good muscle tone on the right side. Doing the same thing here, don't let me lift up, don't let me push down. Very good, so there's good muscle tone on your left side, so let's measure 5 out of 5. Okay, so I'm gonna check your knees. Okay, so there's patellar is intact on both knees, no dislocation, no swelling, no bursitis on both knees as well. So I'm gonna just have you sit back up really quickly so we can test your knees. Okay, so you can relax, very good. So there's good passive range of motion on both knees. Okay, so I'm gonna just have you extend both knees and bend both knees. So there's good active range of motion there as well. Okay, so with your knees, I'm gonna push against it, please try to extend it. Okay, very good. Now I'm gonna try to pull up, please try to flex, very good. Okay, so there's good muscle tone there, and it's measured 5 out of 5 for both knees. Next, I'm gonna check your ankles. So I'm gonna pull this out here. Hold on. Okay, so ankles look good so far. There is no bursitis or any swelling on the ankles. Okay, so there's good passive range of motion on bilateral ankles. Okay, so first I'm gonna have you flex your ankles, extend them, turn them inwards, and then turn them outwards. Okay, very good. So there's good active range of motion there. Okay, so next I'm gonna test your ankle strength. Okay, don't let me push down, and don't let me push up. Very good. So this muscle tone is good, and there's measure 5 out of 5 for both feet. Okay, so next I will be testing for your reflexes. Okay, starting with your tricep reflex, I'm gonna have you extend. Please make a fist for me so I could try to find the tendon first. Okay, just have you make a tight fist. Okay, so here, okay, and just completely relax for me. Wait, try again. Just make a fist one more time. Wait, make a fist like this. Just want to felt your tendons here. Okay, try to bend it again. Just hang it, relax. Okay, so that's a very good reflex. Let's try on the other side. Okay, make a fist again. Let me try to find the tendons. Okay, make a really tight one actually. Tight fist. There we go. Okay, just relax here as well. Okay. Okay, let me try one more time. Okay, one last time. Okay, so very good. Okay, so next, I'm gonna just have you make a quick fist so I can try to find your brachial tendon. Wait, extend it all the way. This is the one right here. Okay, just relax. Okay, so I did see the reflexes up there, so that's good reflex. Going on your right side, I'm gonna do the same thing, make a fist for me. Just wanna find the tendons first. I'm gonna hyperextend your arm a little bit. Okay, and then just relax. Okay, okay, so I do see the reflexes there, very good. Okay, so next is your brachial radialis. Okay, so make a fist for me real quick. Okay, for here, 2 centimeters, okay. Okay, relax. Okay, so that's good reflexes there. Let's try on the left side as well. Make a fist for me, just find the tendons. Okay, so it's here, wait, right here. Okay, so that's actually good reflexes there. Next, I'm gonna be testing your knee reflex. Okay, so just shift your legs down a little bit, starting with your right. Okay, so that's good reflexes there. Hold on. I'm gonna feel it right here. Okay, so that's actually a good knee reflex there as well. So last, I'm gonna test for your Achilles tendons reflex. So I'm gonna have you turn onto your stomach. On this. I just want to pull it, yeah, just like that. Just completely relax your feet. Okay, so let me just try to feel for that tendon here, just here. Okay. Okay, so that's actually a really good one. It's a good reflex. I just need to find the tendons here for a second. Okay, and just relax this foot. Okay, so that's actually a really good reflex on the Achilles tendon. Okay, well, in this position, I'm gonna do the Babinski reflex, okay? Very good. Very good. So the Babinski reflex is negative. Perfect, so I'm gonna have you just sit back up. So in the sitting position, I'm gonna do the arm drift test. If you could just please close your eyes and just lift up your arms. Okay, I'm gonna count for 15 seconds. Very good, so there is no arm drifting. So keeping your eyes closed, I'm also gonna do the sensation test. Okay, so you're gonna just tell me whether it's sharp or dull, okay?
Sharp, dull, sharp, dull, sharp, 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 sharp. Oh, sorry, can you do that again? Dull,
Okay,
dull, dull, sharp,
okay,
sharp.
okay, very good. So keeping your eyes closed, your sensations are intact from all those tests. So keeping your eyes closed, I'm gonna do the vibration test. You're gonna tell me if you feel the vibrations.
I feel it. I feel it. I feel it.
Okay,
I feel it. I feel it. I feel it.
okay, and then one last one.
I feel it. I feel it.
Very good. And then the other, your vibration sensation is intact. Still keeping your eyes closed. I'm just gonna put 2 objects. Okay, one in each hand. You're gonna tell me what this is.
This is a coin.
Okay, and the left hand.
This is a key.
Very good, so that's good. Okay, so I'm gonna put the object in the right.
This is a key.
Okay,
This is a coin.
very good. So you're able to identify the object with sensation, so you can open your eyes now. So next, what I'm gonna have you do is, I'm just gonna move this out here. You're gonna do the coordination test, okay? You don't really have to, you can sit up and do this. I'm gonna have you bend this knee using your heel to touch from your knee down on the left side. Very good. Do the same on the opposite, so there's a good coordination there. Then next, I'm just gonna have you close your eyes with one finger sticking out. Try to touch my finger and then touch your nose. Okay, do the same on the left side. Very good, so there's good coordination there. Okay, so now I'm gonna just have you stand and I'm gonna take a quick look at your spine. So right here, okay, so there is no unevenness on the back of your spine. All right, okay, so I do see your spine, your cervical spine, I'm sorry, your spinal column, and it's midline. I'm gonna have you bend down slowly, bend forward slowly. Okay, so there's no misalignment to your spine, and there's no crepitus also palpated on your spine as well. I'm gonna have you just bend backwards. Very good. Okay, turn this way, turn the other way. Okay, very good. So there's good range of motion of your spine. Okay, so now next I am gonna have you turn towards here like this. Very good. I'm gonna have you close your eyes. I'm gonna do the Romberg test. This is testing for stability. I will have one hand catching you in the back if you do fall. And I'm going to have you stay like that for 15 seconds. Okay, looks good. So that's negative. You're actually pretty stable. There's no swaying. So now I'm going to just have you go that way. I'm going to have you walk towards me.
Okay.
Okay, so you might have to shift over a little bit here. Okay, very good. So using walk towards me heel to toe. Okay, so that's good. There is no swaying and no swinging gait. Okay, now walk toe to heel backwards. Very good. So there's good arch on your feet, and it's also no swaying, and the gait is smooth. Okay, let's just have a seat back here, and that's it. That concludes our head to toe assessment. Thank you.